millions of people around the world are coping with rare, chronic disorders, and they need your help. You can become an essential part of saving someone's life by simply donating your plasma. Plasma can't be made in a laboratory, so it's extremely important that healthy adults donate. Plasma is used to produce therapies that provide vital proteins such as immune globulins and blood clotting factors in patients with rare, life-threatening diseases. In fact, it can take more than 1,000 plasma donations to produce enough therapy to treat one adult patient for 1 year. Consequently, plasma donation is vital. So what is plasma? Plasma is the clear, straw-colored liquid portion of blood that is left over after red and white blood cells and platelets are removed. Plasma accounts for about 55% of human blood. It contains water, salts, enzymes, antibodies, and other proteins that aid in blood clotting and helps defend the body against infection. It's important to understand that donating plasma that is used to make therapies is a little different than donating blood. Unlike blood donations, donated plasma is not used for blood transfusions at hospitals, but rather undergoes a complex and well-controlled manufacturing process to create life-saving therapies. Donating plasma is a great way to make a difference in someone's life, and therapies are used by patients all over the world, as well as in your own community. Donation centers are located across the country. Visit donatingplasma.org to find one near you. Here's how to get started. When you enter a donor center, you'll be greeted at the reception desk. You'll be asked to provide some proof of identification, such as a valid driver's license, social security or INS number, and proof of residency, like a utility bill. You'll also need to verify that you are at least 18 and are in general good health. You'll then take a few minutes to fill out a new donor history questionnaire, either using a computer or a printed form. It's important for the health of the donor and the safety of plasma protein therapies that donors provide accurate health history information. After filling out the questionnaire, your veins are checked to make sure they are suitable for the physical part of the donation. If you remain eligible, you will then go into a private room for a physical examination. Your health history questionnaire will be reviewed at this time, and you'll be asked some additional questions about any medications you may be taking, tattoos, piercings, recent travel, or any high-risk behavior that may eliminate you temporarily or permanently as a suitable plasma donor. During the exam, you'll be observed for your general state of health, your vital signs taken, and your skin, head, neck, heart, lungs, abdomen, and reflexes will be checked. This physical exam takes place annually if you become a regular committed donor. Once the physical exam is completed, a technician will take a blood sample to test the protein levels in your blood. You'll also need to verify you weigh at least 110 pounds. Your temperature, pulse, and blood pressure is also taken to make sure you are ready to donate. These tests are performed and the health history questionnaire administered each time you donate to ensure that your health has not changed. After the testing is done, you'll be taken to the center waiting room until a donation bed is available. Once a donation bed is free, a trained technician will escort you and will evaluate which arm to use for the donation. The technician will then verify your name and other information, which is printed on the donation bag or bottle and 2 testing tubes. The sterile, prepackaged tubing materials that are used with the specialized medical equipment that collects the plasma are then unpacked in front of you, and the collection device is then prepared to take the plasma donation. After the technician places a tourniquet on your upper arm, they'll clean your arm with a sterile solution and then insert the needle. The machine will begin to cycle to start collecting the plasma once the needle has been inserted. Your plasma is collected through a process called plasmapheresis. Your blood is pumped into a plasmapheresis device that separates the plasma from the other blood components, such as red and white blood cells and platelets. While the plasma is collected, the other blood components are filtered into a reservoir. Once the reservoir is full, your red and white blood cells and platelets are returned to your body. Throughout the donation process, the system automatically alternates between collection and replacement until the predetermined amount of plasma, which is based on your weight, is obtained. Donating plasma has a long record of safety. Nevertheless, trained staff carefully monitors the entire donation process to make sure that donors are comfortable and healthy throughout the donation experience. The entire process takes around 45 minutes. So bring along a book or your laptop to help pass the time. Once the plasma donation process has been completed, the device alerts the staff and you'll be disconnected from the machine. You'll then be directed to the checkout desk in order to receive compensation for your time and effort involved with the donation. Typically, the compensation ranges from $20 to $30. It's important to understand that the process for a first-time donor can take up to 2 hours or more, including the health history questionnaire, medical examination, and the actual donation process. Plasma is replenished by your body relatively quickly, much more rapidly than red blood cells. In the U.S., a donor can give plasma twice within 7 days, with at least 2 days in between donations. By contrast, a blood donor may only give blood once every 56 days. Plasma protein therapies made from your donated plasma are used to help treat people living with life-threatening diseases. For example, bleeding disorders such as hemophilia and von Willebrand disorder, primary immunodeficiency diseases, which rob a person's ability to fight infection, alpha-1 antitrypsin deficiency, a genetic form of emphysema that severely damages the liver and lungs, and chronic inflammatory demyelinating polyneuropathy, a rare disorder of the peripheral nerves. Plasma protein therapies also are used to treat serious medical conditions such as trauma, burns, and shock. The industry not only adheres to U.S. and international regulations, but demonstrates its commitment to quality and safety by the introduction of a voluntary set of industry standards called the International Quality Plasma Program, or IQPP. For that reason, plasma from one-time only donors is not used to produce a therapy. A donor must return to the center to donate plasma within 6 months of the initial donation before either donation can be used to produce a therapy. This industry practice is one of the voluntary standards developed to help ensure that we collect plasma from healthy and committed donors. Patients who need plasma protein therapies rely on healthy, regular, committed plasma donors. The long manufacturing process to create a therapy taken by a patient is 7 to 9 months. So the critical need for these therapies makes it essential to compensate qualified donors for their time. There are about 400 FDA licensed and IQPP certified plasma collection centers in the country, and approximately 20 million plasma donations were collected last year. Donating plasma takes time and is a commitment, but is a meaningful and valuable way to give back to your community and to patients in need. To learn more about becoming a plasma donor, visit donatingplasma.org.